Okay, so here is a map of NNLM. If you're not familiar, again, I mentioned that I'm with Region 1. We are based out of the University of Maryland, Baltimore, here in Baltimore, Maryland. We represent these states here in the light blue. Where you are located in the continental US and the Virgin Islands and Puerto Rico, you do have a medical office that serves you. If you're not sure, I'll put the link down in the chat so you'll be able to find the office nearest you. And again, all of our programming is open to you no matter where you are. Even if you're international, you just may not have a medical regional office that serves you. So what do we do primarily? We do three things. We primarily offer free webinars and classes to librarians, health professionals, and the general public. We also offer access of networks to libraries and organizations. If you are in a medical center or a hospital, you may recognize us also supporting a service called DocLine. And then we also provide funding for health information outreach and digital equity. Right now, we actually do have a call for applications out for our Region 1 awards. You can find that on our page when you actually find us on Region 1. I'll be sure to put that down in the chat as well. So for today's agenda, we're going to describe Prince George's County Memorial Library System, the structure and the demographics of the communities where the featured programs exist. We're going to discuss the programs, including the purpose, the genesis, the budget planning, success and challenges, and other resources. And we're going to identify how to replicate these program examples in other library settings. So I'd like to introduce today's speakers. We have Melanie Towson-Diggs, which is South Area Director for PGCMLS County System. She oversees the branches in Accokeek, Oxon Hill, Clinton, Upper Marlboro. She has over 30 years experience in public and school libraries and received a number of accolades, including those from various library associations for her work. In her personal life, she served as an advocate for healthcare in Maryland, drawing on her own experience of being uninsured and using Medicaid. She also serves on the board of directors for Families of USA, a national nonprofit organization dedicated to helping provide high quality, affordable healthcare and improve healthcare for all. We also have with us Kamar Roden, who is Central Area Director for PGCMLS, overseeing branches in Glenarden, Hillcrest Heights, Largo, and Spalding, has more than 10 years worth of experience in libraries working in a variety of leadership, advocacy, capacity building, and community engagement roles in both public and academic libraries. Kamar is an active member of the Maryland Library Association and the Library Information Association of Jamaica. And lastly, we have Karen Luoma, who is North Area Director for PGCMLS, overseeing branches in the area of Beltsville, Bowie, Greenbelt, and Laurel. She started her career at the Baltimore County and joined PMLS later in 2003 as a library associate, working her way up to her current position. She holds an MILS from the University of Maryland and a BA in political science from the University of Maryland. Her background interests include program development, programming, outreach, and health information, completing several NNLM trainings that are eligible for the Maryland Medical Library Association Consumer Health Information Specialization. Thank you all so much for being here today, and I'll stop sharing so you can go ahead and start your presentation.
Good afternoon, everyone. Welcome to Snapshots on Health and Wellness Programs. This is a presentation where you'll be hearing from myself, Melanie Towson-Diggs, Kamar Roden, who's here with us today, and Karen Luoma. And Faith kind of read over to us our objectives already, but we just wanted to go back over them for today. We will be describing the Prince George's County Memorial Library System structure and demographics of communities where the featured programs exist. We'll be discussing the programs, including purpose, genesis, budget planning, success challenges, and other resources. And we're going to be able to identify how to replicate these program examples in other library settings. All right, we thought it would be great for you to have kind of an overview of Prince George's County Memorial Library System. The Prince George's County Memorial Library System helps customers discover and define opportunities that shape their lives. The library serves the 967,000 plus residents of Prince George's County, Maryland, through 19 branch libraries, a 24/7 online library, the County Correctional Center Library, and pop-up services throughout the community. This slide also shows you some information here about the population growth. We're looking at 12% over 10 years. So Prince George's County is really growing. In the population, looking at the age ranges of people who live there and focusing primarily on those 60 and over, you see that 14% of our population is over 65 plus, 64% is between 18 to 64. 36.2% of our adults in the Prince George's County area have high blood pressure. So this is important when we were thinking about coming up with health and wellness programs in our communities. And we see that 67 census tracts are in medically underserved areas, including Akakeek and District Heights, where our programs are located. And so now we're going to dive into a little bit of a look into the communities where the programs exist. So the Akakeek branch is where one of our programs exists, what we're talking about. And the community demographics you see are here. We serve 12,745 people in that population, and out of that, 387 people are in poverty. Non-English speakers, 3%, just a little over 3% are non-English speakers. We looked at households without internet because, having access to internet is essential in this time. So in this area, there's like 111 households without it. Looking at the health and wellness of the Akakeek area, overweight adults from 2018 was 70%. So we have a good number of folks who, customers who could benefit from our health and wellness programs. And also adults with high blood pressure as of 2021 was 37%.
Thank you, Malini. I'm going to share some information about the Greenbelt community. As you can see, the Greenbelt community is still fairly suburban with a steadily increasing population similar to Akakeek, although it's only increasing by 8%. There are a few people who are unfortunately living in poverty, but the language difference is significant. We have 14% of our population who does not speak English as their primary language. We also have several more households without internet, but our community in Greenbelt does maintain that same trend that the entirety of Prince George's County has, which is about a 70% rate for adults who are struggling with weight concerns, as well as that 30% rate for high blood pressure. The Greenbelt community, however, is incredibly walkable, which is slightly different than the Akakeek community. It is the branch itself is centered within the heart of the community. And now Kamar, I think, is going to share about Spalding.
Thanks. Spalding's is located in central Prince George's County. The branch is in an excellent location. It's close to shopping areas and public transit, and also fairly easy for residents to walk to the branch. The branch serves a population of approximately 93,000 people, which is a 4% increase since 2010. Just under 10,000 people living in poverty, 14%, well, closer to 15% actually, non-English speakers. Households without internet, 4,128. And then, as you can see, adults overweight, just about 73%, and adults with high blood pressure at approximately approximately 37% based on the numbers we had from 2018 and 2017.
So thank you, Karen and Kmar, for those statistics about Prince George's County, Memorial Library System, and who we serve. Now we're going to dive into one of our programs, our snapshot on Get Active, Ride and Read. And so a little bit about the inspiration for this program. So back in March of 2022, a policy map meeting kind of dived into the area of Accokeek and showed us that 3/4 of the Prince George's County residents were overweight. And more specifically, seniors in Accokeek were considered as an underserved population for health. And in the Accokeek Library, we do see a lot of seniors coming to use the library. And so we thought that, wow, with this information, this data from our policy map, looking at the community specifically, we thought about what could we do to develop a program that would be dedicated to the health and wellness of this population in particular. And we already knew the library had plenty of resources, digital and print, on health and wellness, but we thought we could also provide a space and tools for the adults to have active and healthy lifestyles. And so with this Get Active, Read and Ride, we have a plethora of e-resources that the adults can access while they're on the bikes. Adult customers can access different e-resources in categories such as arts and crafts, DIY, magazines and newspapers, genealogy, reference and research, streaming media, audiobooks and ebooks, and language learning, to name a few. And, you know, this also program with being on the bike and connected to a tablet, giving you that opportunity to engage tactile learners as well. So learning as you're, you know, going and doing something, which invigorates the brain. And so just to go over some of the equipment that we have in the Get Active Ride and Read program, we have 5 to 6 stationary bikes. And with the stationary bikes, we found out that if you have a floor that doesn't have resistance, they're not on carpeted floor. So we needed to put something under the bike so that they won't move. They are stationary bikes, but if you're really, you know, giving it some energy there, you might run across the floor. So there's 5 to 6 floor mats underneath the bike. We have 5 to 6 mounted bike tablet holders, and that was interesting in itself, trying to find a tablet holder for the bike and just positioning it just so that people can see what's on the tablet, the app, PGCMLS app that we have there, and also be able to ride at the same time. 5 to 6 tablets, and the estimated cost for the initial pilot was between $1,956 to $2,346. So it was a minimum cost. I mean, when you think about the scheme of maybe programming and how much you have in your budget. So just looking at the timeline of how we work this out. So as I stated, around about March or April of 2022, this project was really spearheaded by our foundation board. So our foundation board is newly developed, and they put out a call to all of the branches, all of the teams, to see if they could get back some innovative program project proposals from the branches. And so we thought about it. Again, I said we had a policy meeting, a data meeting, a policy map meeting, and around May 2022, that proposal that we sent up was approved. And what was so great about this, all of the proposals really that were sent to the foundation board got awarded. So it was a win-win for everybody. um, from June 2022 to December 2022, we went to work with ordering equipment, creating and submitting a program plan, discussing and creating waivers. We talked about testing the equipment, right? Somebody had to be the guinea pigs. So staff there at Akaki got on the wheel. Can you imagine the wheel, right? Got on the bikes and tested it out just to see how the equipment was working. And indeed, we needed IT along. They were our friends because they had to configure the tablets for customers' use. So everybody, was involved with getting this project up and running. And then January 12th, 2023, we had the soft launch of Get Active, Ride and Read at Akaki. That was a great day because we had some of our foundation board members even come out to test the bikes. All right, so we've been at the Get Active, Ride and Read as of January 12th, 2023, the supervisor that we had there helped me with these statistics. So we've had 65% participants since then. I think that's a pretty good number. We continue to promote the program and, gain customers who didn't know about the program and come through the door and want to participate. I thought it was great to give you some anecdotal customer comments, along with quantitative as qualitative information too. So here's some quotes. As someone who's retired, it is nice to have a place to come to in the middle of the day where I can get exercise. Another person said that it means a lot to have a space where not only I can get some exercise, but my kids are close by and they are entertained and learning. Now, this was a parent who exercised while the child could be close by reading or using ABC Mouse. So you see how it was an intergenerational kind of program with the kids being in the room, right in our meeting room, and able to use their own tablets and devices and get on some e-resources that we have as well. Another customer said, I love the fact that I can get exercise and learn Spanish at the same time. So that shows the diversity of all the things that people were doing on the tablets. Being able to read really helps motivate me to exercise. And in fact, if you look at, we have some other resources that Faith will be sharing out later, but when you look at some of the things where people have instituted this kind of writing and reading program, there are some data and statistics to show that it does help motivate people to read more. And lastly, Ride and Read gives me something to do before I have to go pick up my kids. And, I'm a mom. So sometimes just having that time by yourself and to able to relax and also to be able to do something that you love to do without the kids around is a wonderful escape, free escape. And so here's some other things to consider if you're thinking about, doing replicating this program in your library system, no matter the size. I think it can be done. Rural, suburban, urban, Akaki, as was alluded to before, is a suburban library where people are coming and driving to, so there's no really walk up, but it definitely is a program that we've seen that people come to take advantage of. So we created a program plan. So that is on our resource list that will be shared out. The program plan really for us at PGCMLS is our guide so that if anybody is slated to kind of facilitate this Get Active, Write and Read program, they can follow through the script and just make sure that they're doing everything that is needed and sharing with the customers exactly what will be happening. Determining the user's age. This is important. We looked at, well, how old should the person be? Because which goes into creating a waiver. So at first we thought maybe that this could be offered to our young people, right? Our youth in the library. But then when we thought about, liability and if there would be any issues with you know uh people getting hurt or things happening which we don't want to happen, it would be best probably to keep it at the age of, I believe we have 16 and older. There are two waiver forms for those who are 16, for those who are adults, just so the parent guardian can still sign off on the 16-year-old, and then the adults considered 18 and older have a waiver form too, because if they're on the bicycle, the equipment on, and something happens, the library wouldn't be liable for their health concern. Um, wow, this general guideline for clothing and footwear, you wouldn't think that this would be necessary, but especially in the summer times when people come and they may not have their feet covered and they may have different types of clothing on, we wanted to make sure that even with the clothing and the footwear that we were being attentive to, what people needed to wear and how they should be exercising. So we said, loose fitting clothing would be best, and shoes that are enclosed, so your whole foot is enclosed, just to make sure that there would be no issues with feet getting hurt or clothing going awry. Date and time for a program. So we looked at Akakeek. I know when we did this, they put out a survey. The staff put out a survey to see when would be the best time for customers to come and utilize the bikes and the tablets. And so our time of the program ended up being on Thursdays, and so that was best for everybody there. And we now have Thursdays from 2 to 3. So that is what is happening at Akakeek. Just to let you know, since this time, Greenbelt has also begun the Get Active Run and Read program as well. And they have the program on Thursday mornings from 11 to 12. And the thing about Thursdays, let me just tell you, that our library hours are from 10 to 6, 10 a.m. to 6 p.m. on Thursdays. And a lot of times, a lot of our programs happen on either Mondays for those parents and story times, things like that, or Thursdays. So there is a rhyme or reason to why Thursdays seem to be a good day for us to do the Get Active, Ride, and Read. And in Greenbelt, they started the program September 2023 was their first session of the Get Active, Ride, and Read. So now we have 2 branches in the system that are that have this awesome program. And last but not least, staffing. As we know, somebody needs to be in the room just to make sure everything is going well, just to make sure if there's any questions or anything happening. So make sure that you have at least one staff member that can sit in the room wherever your bikes are stationed, and just keep an eye out on what's going on. I think that's it. And so we did find a brief chair exercise video. We can do this now.
I love the chair for a lot of different support options. One of my favorite exercises is using the chair for a squat. So why don't you join me, sitting forward in the chair, your chest up nice and tall. Begin with your hands on your hips, your feet right underneath your knees. Just lean forward halfway. Put weight in your feet. That's all I need you to do. And then come back up nice and tall. The next thing we're going to do is bring our arms out in front. I want you to push weight in your feet like you're going to stand up, but we don't. We're calling that a pressure squat. I push weight through my feet, I squeeze my glutes, and then I release back to a nice tall position. One more time. Push weight into your feet, squeeze your glutes, and back to a tall position. Now, if you're ready, we're going to stand up. Here we go. I hinge forward, I push weight into my feet, and up we go. Then walk back so that you can feel the chair on the backs of your legs. Push your hips back, lower down, make sure the chair is there, have a seat, and then hip walk forward in the chair, and we'll do that again. Hip hinge, put weight in your feet, come on up. Walk back, feel the chair on the backs of your legs, push your hips back, make sure it's there, have a seat, and hip walk forward. So here's why this exercise is so great. The push to stand up is so functional, but I love walking back, feeling the chair on the backs of my legs as I sit back, because lots of times with a squat, people will tell me, Andy, this hurts my knees. And usually it's because we don't have good posture or form with our squats. Our knees are coming forward. The chair guides us to help us to know to push our hips back and keep our knees over our feet. One more time. Here's the last thing I like. This hip walk forward is great for hip mobility. So this makes it a great total body exercise, but definitely effective for strengthening your glutes, your legs, all the way down to your feet.
Hi, thank you. We wanted to share this video with you just to give a little break because we know that it's been a long day and we wanted to have like a little chair exercise. It's also an example of one of the things that we is part of our next program that is offered at the Greenbelt branch, in addition to the original location, Spalding's. This part of the presentation is about a partnership opportunity that came to Prince George's County library system, mostly because the University of Maryland School of Nursing was like, we really want to expand our student nursing clinical experience program into other libraries within the state of Maryland, but somewhere within close proximity to Baltimore City. And our library system at that time, and still is, known for innovation and willingness to try new things and new programs that we could bring to any one of our locations. At the time of this partnership opportunity, we had incredible support in our administration, and they helped bring this to fruition. Our original intention was to hopefully have this program at multiple branches, because we were like, yay, this is such an awesome thing. We want all of our branches to have the opportunity to have nurses in the community. And I'm going to let my, is it still me, Kmar? I lost my notes. I'm so sorry. You're muted.
Oh, yes, I was saying it was still you. If you could just.
The technology was going too smoothly there for a second, but the second I did the video, everything went haywire on my two laptops. Sorry. So that brings us to the title of our next program, which is our Talk Health program, which is the collaborative program that we have with the University of Maryland School of Nursing. Initially, as I said, we wanted to offer this program all across the 19 locations in Prince George's County. However, reality quickly set in and we had to adjust our expectations. During the initial discussions, the University of Maryland School of Nursing shared that they were hoping to focus just on one location, as it was a single class that would be supporting this community clinic experience. However, they were kind enough to say, we're going to go talk to the instructors and the faculty and the students and see if maybe we can do multiple sites. Unfortunately, that did not pan out for the fall semester. The program ended up being called Talk Health. And now my colleague, Kmart, is going to delve deeper into the details of the Talk Health partnership.
Thanks, Karen. So we narrowed down the location to the Spalding's branch library based on community demographics. According to Policy Map in 2023, the District Heights and Suitland communities could be considered medically underserved areas, as they had very limited access to medical facilities, health services, hospitals, things like that. Policy Map also showed us that these communities had a prevalence of some morbidities, such as high cholesterol, depression. A significant portion of the population that the library served was overweight. And so our original plans included Mondays based on the instructor's schedule. And also because we have an existing program at Spalding's, or caseworker in the library program, where customers can come and talk to a social worker and get help with a variety of social services. So we thought it would be good to pair these programs, and that way we would serve a broader collection of community residents, and it would encourage more people to come to the library on Monday mornings. We also intended to connect with other potential community organizations, and basically to highlight health and wellness resources that are available within the community. So, that's why we thought Spalding was a really good fit for this program. And Karen, if you could just move up to the next slide, right? We thought it'd be good to share the timeline here. And as you can see, in April and May, we had discussions about the expectations for the program. And, we talked about how we could work together to ensure that the program met the objectives of our library system and the School of Nursing, and at the same time offering a very valuable service to the community. In June, we had site visits at Spalding's. Staff from School of Nursing looked at the space and made decisions about how it could be used. So we looked at where the nursing students would be based. We looked at where the main sessions would be held, where we would do our activities like the blood pressure checks and so on. And then in July, both our PR department, so the library's PR department and the School of Nursing's PR department, had marketing discussions and planned for media events. We really wanted to ensure that the program was promoted as widely as possible. And the last button on our timeline is September. The program was expected to begin in September, and unfortunately, we had a last-minute site change due to facility issues at the Spalding's library. So we moved to Greenbelt. Many thanks to Karen and her team. And we had our first session in September. So in the planning stages, there were many ideas and thoughts for what the initial pilot semester for the programs would look like. And this was just the tip of the iceberg. What you're seeing on screen here is just a good example of the ideas that were floating around in our minds. This was new to us, and we were really excited to bring this new service to the community. So, we wanted to have a blood pressure clinic to address hypertension issues in the community, presentations and discussions around healthy eating and medication management, given the lack of food options or lack of healthy food options and medical providers in those communities. And so the big question was, how do we take all of these ideas from a class instructor, from the library staff, from the School of Nursing's team, and how do we fit all of that into one cohesive program that would work for the community? And so we put them all together and we made a day of it. Sarah, our instructor, requested time at the beginning of the program, also at the end, for basically instructor-led time to work with the students. And so the pre-conference was followed by a blood pressure clinic, then a lunch and learn session with a health focus, and then another blood pressure clinic, then a seated exercise, then an engagement activity to encourage and entice participation, and then another blood pressure clinic. So, you know, it sounds confusing, right? And to some degree it was. And we had challenges getting some of our customers to understand that, you know, they weren't required to be there for the entire day from 11 to 4 p.m. It was intended for them to just drop in when they were available and, you know, leave when they were finished with one particular activity. So, you know, we learned a lot from that, and Karen will now talk a little bit about how we used what we learned and how we've tried to adjust the program for customers to make it easier for everyone and make better use of their time as well.
As you may have seen in the timeline in September of 2023, as Kmar alluded to, Greenbelt was the new location for the Talk Health Fall 2023 and Spring 2024 semesters instead of Spalding's. It just worked out perfectly. We had the space available, we had coinciding programs, so we could have a built-in audience who would be coming into the building that would increase the foot traffic. Greenbelt branch is also located next door to a community center and a recreation facility. We had just started the Get Ride and Read program at the same time, so it felt like a natural fit for us to be like, cool, we're just going to add this one extra health and wellness program into our community, and we can talk it up at both events. Over the course of the 8 weeks at Greenbelt, we had about 104 participants throughout the program. The average age range of the participants was between 58 to 60 years old. And the nurses also shared that they were able to identify about 32% of the population that visited for that program who had their blood pressure tested actually showed that they were met the criteria for stage 1 hypertension, and they were referred to primary care or medical resources in the community. So it was definitely an example of how bringing this type of program into the community, instead of relying on going to a hospital or going to another facility, actually helps the community at large. It increases their knowledge, it increases their awareness. It also gives medical professionals the opportunity to see what's going on. As part of their program, the University of Maryland School of Nursing students had to complete a final project. And during the semester, the instructor, Sarah, and I discussed utilizing the display case that's located in Greenbelt to create a display. The topic chosen by the students was to create a winter health focused display since the semester ended right before the holiday December. The display highlights the importance of eating healthy, staying active, managing stress, and getting vaccinated. And you can see the results of their efforts in the picture displayed. Underneath each category are little tips that they recommended to have the best winter possible for your health. Some of the lessons that we learned from the fall semester was that the schedule really needed to be simplified and more focused. The spring semester of this program, which started just 2 weeks ago, features a blood pressure clinic that runs for 4 hours each session. And then during that time, concurrently, they also run a 1 hour long session with a health topic, which is what I refer to as lunch and learn, because you're encouraged to bring your lunch with you, listen to the health topic, and then they do a brief low activity, low cardio activity just to engage you, and then a brief meditation at the end. The biggest takeaways from this experience were that communication was incredibly important, as well as our flexibility. We had to change locations at the last minute. The School of Nursing had a late notice instructor change, which means our entire original plan had to be slightly tweaked based off of the new instructors' interests. The first season of the program modified a little bit each week until the final week was eventually based off of who was attending and what the community's interests were really looking like. The entire fall program helped inform the needs for the spring programs, which I think is running really smoothly. It's a low-key start. We're in week 3 this week. Tomorrow is our next session, and we're really excited for it. As for marketing, there was a plethora of media interviews and articles that came out announcing the Talk Health program and new partnership between PGCMLS and the University of Maryland School of Nursing. And as an example of that, we have a slide to show you, which gives you a brief overview of the entire program.
The partnership with the School of Nursing, it's something we're really excited about. Our library is always looking to expand our health and wellness programming. The community really relies on us for very important services. There are many barriers to people accessing health services. And so by bringing it here, a place where they're already gathering, a place where they trust the staff, they trust the team here, it eliminates those barriers and it makes people more comfortable engaging with those services.
So there's a lot of people who can't always get to these kinds of things or go to a doctor. So it's really nice when the things come to the community instead of the community suffering or, not having access. So.
What we've been doing in this location is engaging with different people, most especially with older adults, because this community has retirees. So they come to the library for different activities, and we've been engaging with them. We've been doing some health screening, blood pressure screening. I just love to give care generally, so that's why I go into nursing.
So we want to try and have the students have an experience outside of the hospital so they can see what are the kind of challenges that people have in their everyday life. People coming into the library may have different backgrounds, resources, education levels vary, so we try and meet them where they're at. In the hospital, it's kind of a very contained experience, and so they get an important but limited experience in the hospital. So we try and get them out of the hospital into the community to try and serve a wide variety of people.
And so I hope you enjoyed our snapshot on health and wellness programs today from the Prince George's County Memorial Library System. Again, I'm Melanie Townsend Diggs, and you see if you need to contact me, my email address is there. Kamar Roden was another one of our presenters today, and he has his email address there. And Karen Loom, her email address is present. And so we hope you maybe take the time out and explore these opportunities to have these innovative programs at your library. Thank you.
Thank you guys so much for putting on this presentation for us. I can actually resume. I remember seeing this in the news and reaching out to you and saying, hey, I saw this on the news. Can you do this? And I think it's so cool. NOAA does a lot of stuff with Let's Move Libraries. And I know that there was like a lot of movement. And so I just thought this would be very interesting to share specifically the stationary bike and the reading, because I actually belong to a gym, but I see people bringing their books and they do this in the gym, but not everybody belongs to a gym. So I thought this was really neat. We had a few questions that Karen answered, but we have another one that popped up. Please, guys, we have plenty of time for questions, and I'll put the evaluation link in here. Oh, good. You answered this question. I'll read it aloud just in case. It's yes, a recording. I'll send that out with the slides as well. And then also there was a question about reminding of the equipment cost. bike and read, and Karen put that in there. It looked like it was a total of about 2,600, which was the actual bikes. And this is just at the Greenbelt location, correct?
No,
No,
that
this
it's
is
the same at Accokeek as well. So we just
Accokeek
took,
and
yeah,
Greenbelt.
Accokeek was first and then it replicated in Greenbelt. Accokeek started in 2022 and Greenbelt last year, 2023. So
And
they use
distance
the same.
wise, how far are Accokeek and Greenbelt? Because for the people who may not live in Maryland, or if they do, maybe they're not familiar with how big PG County is. Like it's really big, and Accokeek is very different from Greenbelt.
Exactly. How long, I guess is it close to 30 miles, Karen? Probably over 20, I'm sure.
It says it's 32 miles away, but it takes 50 minutes to get there.
Mm-hmm.
And that's like not with traffic. That's just
Right.
the
So
types of
probably an
roads you're
hour.
driving. Yeah.
And then there was
That's
questions Karen had answered earlier about like storing the bikes, putting them away, because I guess some people might have space considerations, but it seems that they're foldable in some ways too, to be able to put away. There's a question here that said, were the 65 users of the bike and read, were they a total at one location, or I'm assuming, is this one you're
Yes,
asking?
that was at
here?
Accokeek.
Okay.
I don't know, Karen, have you all started gathering your statistics?
We have the numbers. I don't have a total, but I can say since we just started in September, we've done it twice a month since September. And on average, they have between 2 to 5 users per session. So sometimes we get a group that comes in and all of them are in use. And sometimes it's just 1 or 2 people who are coming in independent.
Great. Do you think that there will be a possibility? I mean, and I know we talked about scale, so I'm gonna ask like this, of course, this crazy question, if it would be able to go to all the branches, or maybe more. Maybe I should say more than all, because jumping out there all is a bit.
Well, I would love to see it to go to at least in our areas, right? At least to have one in every area. So we would have north, south. We already have north and south. So central and and west area would be great to have the Ride and Read program. We have a new CEO, so hopefully we can pitch that to him.
Yeah, and this
And
is
our
still
foundation board.
and it's still considered a small scale, because you're talking about
Yes.
5 to 6 bikes, right? Like you're not talking a
Right.
whole room like a gym would
No,
have, perhaps. Yeah.
no,
So I
just a
guess the
few.
next iteration, or a possible iteration, could be additional bikes. Would there be room for that to make it bigger than 5 or 6?
I think 5 or 6 is manageable at one location. I would hesitate to add more than that. Karen is showing you the bikes, what they look like. They came right from Amazon, and so they are foldable. You see how they are collapsible there. And they can store into your, closet. At Accokeek, we have a closet right in the meeting room, so and it's not heavy. It's not too cumbersome to be able for a staff member to be able to move them out. Like you wouldn't need your building and grounds personnel or somebody like that to move. It's not heavy equipment.
Great. And we had a question that Karen answered about the funder. It was the foundations are great, for these kind of things, because that fundraising arm for them to, oftentimes you can bring an idea to them and they can try to figure out, how to actually fund this. And so the question about the partnership with the University of Maryland, Baltimore, are you guys again looking to expand that out? Because again, I know you had some scaling. Ideally, it was going to be all the branches, and then you've had some issues. So now that you've had the initial pilot and you've had some experience with it, will you try to expand to more? I mean, all I know is a big ask, but
Yeah, I was gonna say, unfortunately, I don't think the limitation is on us because we have space and we would love to have it everywhere, but this clinical experience is a limited selection of students and it's a limited number of instructors who are doing that same activity. So it's coming from the School of Nursing about what limitations. The spring semester, as we said, is being held at Greenbelt. Our hope is that it will be possibly expanding to both Greenbelt and Spalding's next semester, or being able to expand in some way, shape, or form to having some version of it at the Spalding's location. But it really is contingent, unfortunately, on the School of Nursing and what they're able to provide and what they're
Sure, and just for context, I mean, Baltimore City to again, Acadie, even Greenbelt is quite a hump. It's kind of far. So, you know, I can understand too, if you have the students that they're based, like living out of the Baltimore metro area, especially if they're living points north in Towson, you know, White Marsh, etc., it would take quite a bit. Would there be, have you considered other schools as well? Like, is it, I don't want to say going to be limited to the University of Maryland, but like, I know there you have like PGCC and other, you know, schools in the area.
I think that's a good opportunity that we might pursue if we're not able to expand with the School of Nursing. I think one of the original intentions for their expansion was to look for an area that was a little further south, because they had students who were going to their School of Nursing who lived in Prince George's County. So they were trying to meet the students where they were versus like having them commute all the way up to Baltimore City or Baltimore County to go to libraries there. So they were trying to meet the needs of their students as well as the community that they resided in.
There was a question here about having the participants sign a waiver so that you guys are, you know, limited. But I have a question in addition to that, and you could tack this on and answer. Do they sign it prior to the class? And is it from session to sessions? Or is it kind of like anytime you ride, this waiver covers you?
Yeah, I mean, we do it every time they come in. So the customer has to sign that waiver before they get on the bike. So per session. Mhm.
Perfect. Well, we have a few more minutes. I did put the evaluation link in there. Even if you're not seeking MLA credit, would you please fill that out? It helps us know like what is of interest to you guys, you know, what we can do to provide more programming to you, you know, what is area in your need. And I do have a question about I guess primarily the people that came to the clinic from the video, and this is just an assumption, was it most like an older population? And maybe just because of the times it was offered, like some people are at work, like I'm at work, I can't jot down to the, you know, I can't go over to the School of Nursing because they're next door. But, you know, I'm assuming most of the people were flexible during the day to be able to attend this type of program.
Yeah, the average, as I said, was between 58 and 60. They did, I mean, that is the average. So there were some families. The morning that was held also has a story time. So they did have some younger caregivers for families, which inspired them this semester to include a little bit of maternal health or post maternity concerns that might need to be brought out a little bit wider in the community. So they're looking at that. They also are doing I guess they call it a windshield survey. So they go out into the community and they put like questions on the windshield to try and like encourage responses to find out what the community really needs. And then they build their coursework there.
Yeah, that's really awesome. I think a lot of times when I've been off and I've gone to the gym during the day, it's like a certain population, you know, usually either they're second shifters or maybe they're off for the day, or maybe, you know, they're retirees, or, you know, whatever it is that they have availability in the daytime hours to be able to come. Did you have very many young people? Because you said someone could be as young as 16 and ride the bike. Have you had a few younger people pop up?
Not at Acadie. I
Not
haven't
yet.
seen any. No, I haven't seen any very young. Have you seen any, Karen?
I was going to say the youngest I've probably seen is in their 20s, early 30s. I can't say that it is, we're not carting them at the door. They weren't, you know, a minor is all I can say that their age was. Speaking about the Talk Health program, one of the things is that it's also dependent on what day the clinical session is being held. So the first semester was the fall semester, and this semester is the Friday. The fall semester was on Mondays. The spring semester is on Fridays. So the day of the week also changed, but it also still ties into that story time age with the parents and their caregivers. And it's more on the weekend, so we're hoping to still see a lot of people coming in just because it is, as I said, a very walkable community. And I believe Kmart would have the same experience. They get a lot of more traffic usually, I think, on the tail ends of the weeks versus necessarily the middle of the week.
Yes, that's right.
So we have a question here that asks, and you may have mentioned it at the beginning of the presentation about this being a part of your strategic plan, this healthy living piece. There's a question here, what are your future upcoming wellness programs? If you'll be expanding. So I guess beyond these two, are there other, I know Kmart, you had that slide that had like cooking and, you know, all these different ideas that you guys were having boiling up from maybe, you know, for the community or just ideas that you might have as staff.
Right. One thing that we did actually very recently was we had I could look for the link to share it in the chat, but we had someone come out to one of my branches to do a demonstration how to prepare healthy meals. And, you know, folks who attended were able to taste. They got a chance to see how these were prepared. It wasn't anything difficult, something you could do, especially for people who are maybe working and you're busy on the go, you know, quick and easy meals that you can prepare that are healthy for the entire family. So that's an example of something that we did very recently that we're looking to expand across our branches as well, especially in areas where there aren't many options for eating out, healthy eating out, and not a lot of, you know, not high penetration of like grocery stores and access to
Almost like a food desert type of
Right.
situation, or limited,
Right.
like you said, maybe it's mostly quick serve in a way.
Right. Yeah. So if, you know, we thought if people were able to prepare these meals at home, then, you know, it would help with what they wouldn't be able to find, you know, when they go out in the community. It's also more affordable, you know, it's quick and easy, it's
Absolutely.
more affordable.
Yeah.
So that's an example of the type of programs that we are looking to expand across our branches.
Well, wonderful. We're at time. Thank you all for your interest, first of all, in this program. Secondly, and not necessarily secondly, but in addition to, thank you so much to you three for coming and putting this on. I really look forward to hearing more about it. I might have you back as you expand because we're really loving to hear about public libraries expanding out and promoting more of their wellness. I don't want to say starting because many of you have already been doing it. It just hadn't been promoted in a way that a lot of us knew about it. And I think that no matter what the library, we can, you know, take inspiration from each other on how to do this. And so to the participants, I'll be sending out the link to the recording as well as the slides and the resource guide. And again, thank you all so much. We hope to see you on the next webinar. And thanks to you guys once again. I hope to work with you again soon.
Thank you, Faith.